How about after the surgery? Is there any possibilities it comes back again?
Okay, I mean, what we used to say is we call as after cataract. That means
Okay.
sometimes what happens is when you place the lens inside the eye, this is actually a model of the lens inside. This is how it is.
Mm-hmm.
So when you do the surgery, you actually open up the anterior capsule,
Mm-hmm.
suck out the cataract, and implant a lens inside.
Oh.
Okay.
Okay.
So what happens is this posterior capsule here
Uh-huh.
can become opaque. So that
Okay.
is what we call as a posterior capsular opacity.
Uh-huh.
So this can happen maybe 6 months or a year or two after cataract surgery. So
Okay.
this is what is technically called as a secondary cataract or after cataract.
Mm-hmm.
So when you say the cataract recurs, it's actually the posterior capsule becoming white. So this actually is a very simple procedure you do, whereby we shoot a laser to make an opening in the center,
Okay.
and then your vision comes back to normal. So that's what we call as after cataract.
Oh. All
You know?
right.
And
Okay. Mm-hmm.
when you talk about the types of surgery that is
Yes.
there,
Yes.
now olden days when they did the surgery, when initial stages when they did the surgery, we call what is called as an extracapsular cataract extraction, whereby they used to make a cut from say about 2 o'clock position up to 10 o'clock position,
Okay.
no, or we say 10 to 2 o'clock. This
Okay.
arc they'll make a incision,
Uh-huh.
and then they will remove the cataract out through the big wound and they put stitches.
Okay.
But nowadays,
Uh-huh.
what we have is called as phacoemulsification,
Uh-huh.
where we use ultrasonic power.
All
So in
right.
layman's terms, sometimes they call it as laser. Okay,
Okay. That's
ultrasonic
layman
power.
terms.
Yeah.
Uh-huh.
So it is like a micro jackhammer.
Oh.
Yeah. It goes in, it crushes the cataract and sucks it out. So the incision is a very small incision whereby you don't have to put any stitch. So it's a stitchless
Nice.
surgery.
So it is a more fast to recover.
Recover is that is why I say that you can get back to work within about 7 days. You can
Yes.
get back to work
Mm-hmm.
because the wound is very small. It
Okay.
heals fast if there is no complications, and you can get back to work. It's called as phacoemulsification. Okay.
Interesting.
Your next question, I'm sure, will be what are the type of lenses that are available?
Yes,
Yes,
please. No
that's
need to ask.
that is a very very important question because
Okay.
those days when the lenses were there, they were only what is called as monofocal lenses, whereby so there's only one type of lens whereby it only helps you to see far.
Okay.
So, but you need to wear glasses for near, for reading, writing.
Okay.
This was the olden days.
Mm.
Okay, when there was no computers, there was no laptops and all that.
Yeah.
So people were getting away just using monofocal lenses. Then as time passed, people wanted to be glasses free because they were depending on doing a lot of near work and all that. Then we had the option of multifocal lenses.
Yeah.
That means we cover you for distance and near, and the need for glasses reduced dramatically. So you're almost about 90% glasses free.
Okay.
Because I will not be able to say 100% because there are people with multifocal glasses who sometimes feel comfortable with having to wear glasses for some near reading. So I will say about 90 to 95% you can be glasses free with the multifocal.
Okay.
Okay. So then now we have what is called as a extended depth of focus lenses. These are not true multifocal lenses because there are some patients who don't want to have multifocal. So and then they want to, but they still want to be glasses free. So these are options of lenses whereby you cover you for distance and intermediate, like seeing your handphone, seeing the laptop, looking at your car, speedometer, and all that. You don't need glasses. So you have a monofocal lens, you have a multifocal lens, you have an extended depth of focus lens. I mean, technology is improving. So options to be glasses free is there. You just have to discuss with your doctor on the options available and make a decision.
Interesting.
But just to let you know, even though multifocal lens is there, I will not advise multifocal lens for everybody because if you're not somebody who doesn't do a lot of near work, not a lot of near reading, there's no need for multifocal lens. Because if you're not reading, you're always outdoor person driving around this and that. I mean, a monofocal. As I said, you must discuss what are your needs.
Need to know the lifestyle.
You need to know your lifestyle. Very important. You need to know your lifestyle. Very important. Yes, I think that you must discuss the options with the doctor to find out what are your requirements, what is the option available. Because not one size doesn't suit all. We need to tailor for each individual what is their requirement.
Okay,
you know, to,
interesting.
you know.
So this is all about cataract. So
Yes,
it means that doesn't mean that maknanya kalau dah tak nampak bila dah berumur tu terus tak nampak. So you can get treatment, surgery to get your vision back.
okay. And we
Get
must also
consultation.
understand the when you say the drop in vision
Yes.
with cataract will not be sudden. It'll be
Mm.
something gradually.
Gradually.
So what I would suggest to
Mm.
people is the moment you start having difficulty to not to see clearly,
Mm-hmm.
I would just go get an assessment done.
Okay.
Because what happens is sometimes they wait so long that the
Mm.
cataract actually becomes very hard.
Ah.
So when you want to do in a surgery for a very hard cataract,
Okay.
the risk of complications is also there. So I will advise, like I said, life begins at 40. Go for an annual checkup, just to get an assessment done. Because not
Okay.
all cataracts have to be treated.
Oh.
Yes.
Okay.
I mean, if
So
you
it
even
means
though you have a cataract,
yes.
which is very mild, but your vision
Okay.
is good, you don't have any problems,
No need.
there's no need for surgery.
Okay. Okay. So somehow after talking to you about this, I wanted to know. Let's say like I've done my LASIK. So how about that, doctor?
Okay, see, when you do LASIK, you're
Hmm.
basically remodeling the cornea, the front part of the eye.
Yes.
So sometimes what happens is
Hmm.
when we do these measurements for the lenses which need to be implanted in the eye,
Yeah.
we take the measurement of the cornea to be in part of the calculation.
Mm-hmm.
So what happens is we always have to use a special formula for these kind of patients,
Okay.
and at the same time have to inform patient that even though we do the cataract surgery for you,
Okay.
there are chances that because you've already disturbed the shape of the cornea,
Yes.
after the surgery the
Mm.
cornea might reshape again.
Yeah.
So you might have to end up wearing a contact lens or glasses.
Because I've been like short-sighted since sekolah rendah.
Okay.
So that's why I did my LASIK. So I'm enjoying.
Yes, no, you
Right.
definitely you are
Yeah,
enjoying.
yeah, right
But
now.
how about in reading now?
Reading, I have to wear
Glasses, yeah.
Yeah.
So those patients who have done LASIK, we always tell them that after cataract surgery, you may not be wholly glasses free. You can use a multifocal lens,
Okay.
but because the cornea has a tendency to reshape itself, there may be a need for you to wear glasses.
Well.
Because there are some patients who feel that I've been glasses free, I want to be glasses free.
They need to understand.
They need to understand. Yeah,
The plus point, is it?
no, not aging, because
Then?
reshaping of the cornea because of the LASIK.
Okay.
So you
okay.
may or may not require glasses. So if you don't inform them to these two patient might get upset thinking that why is it that after cataract surgery I have to wear glasses,
I see.
especially post LASIK patients. We have to inform them. They have to be careful on this. They should be aware of this.
Good information for me.
Yes.
Yeah, because still enjoying the no glasses, but perhaps after gradually,
No,
then
just as I said, you have no glasses for distance,
yes,
but for reading, you're still using glasses.
correct. Correct.
So that is something that,
Well, that's my choice. Somehow, yeah.
No, but it's okay.
Well,
If you don't mind asking, how many years ago did you do your LASIK?
Actually, I just did about 3 years ago.
Okay.
Quite recent.
Quite recent, okay.
Yeah. So because my power is quite high, so I just wanted to be glass free. And when I went for the checkup, the doctor said I still can go for LASIK. So I did that. And the thing is, after I've done my LASIK, I need to wear glasses to read. Vice versa. Before this, I don't need
And that's
to use. That's it.
that's
so now I don't like to read books anymore.
see that is one thing that we really need to look into, because sometimes there will be a lifestyle change.
Yes, it does. It affects a lot. Last time I was a bookworm. Now no more.
Because you don't enjoy it because you're having difficulty. Yes.
Yeah, correct.
So no, these are things that we need to understand. That's why I will always say we need to understand. You need to discuss your lifestyle with the doctor who's treating you, and then choose the best option.
True, because when I discussed with them, I had my discussion. I really wanted to feel how not to wear heavy glasses, contact lenses all the time. To enjoy the outdoor lifestyle and all. That's why I go for LASIK. And they already advised I might have the difficulties in reading. So I understand that.
Understand and accept it. So that's most important. So that should be fine.
Good tips from Dr. Naren. Thank you so much for today, Doctor. Hopefully, I can meet up with you again for other topics.
Yes. Not as a patient.
Not as a patient. Okay, remember that.
Not as a patient.
Okay, thank you so much,
thank you.
Doctor.
Thank you. Bye-bye.
Bye.